We talked last week, and the National Advisory Committee on Immunization came out with recommendations around booster doses for 12 to 17-year-olds, and they did confirm a 6-month interval was the interval to be used. They also confirmed, and this is something that we'll be making sure people have access to later this week, that people who, similar to adults who have in the 12 to 17-year age group who have clinically extremely vulnerable, have immune compromising conditions and a few other conditions, should get a third dose as part of your primary series, and then a fourth booster dose 6 months after that. So that will affect some people who are immune compromised in that age group, and you'll be receiving your invitations for that. For other people in the 12 to 17-year age group, NACI has recommended that a booster dose be provided to people who are at high risk, and we for a number of conditions, and we have those outlined at 6 months of age. So that's people with diabetes, people with a number of other conditions that increase the risk of having more severe illness. And for others, it is, in NACI's opinion, more of an optional risk-benefit analysis that you do yourself. So how we will be doing it here in BC, after discussion with our BC Immunization Committee and our immunization team, we will be sending invites to all 12 to 17-year-olds with information on the benefits and risks of boosters at your 6-month interval. And you will have the ability to make that decision and book yourself. And we do, of course, continue to strongly recommend that anybody who has an underlying condition that puts them at risk does get their booster dose. We have seen, and we see it in the hospitalization data, that it's important for protection not only against infection, even from Omicron, but also really important for longer-term protection against severe illness.